morning. My name is Maggie Paris. I am a hospice care consultant with Moments Hospice, and my counterpart today is Ashley Herdering. She is one of our amazing social workers at Moments Hospice. And today we have the opportunity, thanks to the decan and everyone here, volunteers, to put this together. We are going to be presenting on anticipatory grief and stages of dementia. Some might be a little bit of a review, but I talked to Christina before and she said, you know, little bits of review are good for everybody. So, okay, dementia and the brain. So I imagine everyone knows what dementia is, but dementia is an umbrella term related to changes in memory and in thinking. There's many types of dementia. The biggest one we know is what? Alzheimer's. Yes, very good. Dementia can cause damage to the brain, and it interferes with the ability to communicate. And then when that happens, normal behaviors and thinking and feelings can all be affected. And then dementia, as everyone knows, gradual worsening of symptoms occur over courses of years. People are going to need assistance with bathing, dressing, grooming, all those activities of daily living are going to need assistance. We're going to go over a little bit of dementia statistics. 6.9 million Americans age 65 and older are experiencing dementia. And that's about 1 in 9 in that particular age group. Dementia can have a significant impact on emotional, physical, and financial well-being of not only the person that is experiencing dementia, but the caregiver as well. And then 15 million caregivers are caring for adults with dementia just in the United States. And that is a lot of hours of unpaid care. In 2023 alone, there was about 18.4 billion hours of unpaid care. And I just want to say thank you. That's a lot of people in this room. I think you deserve a round of applause, honestly. So looking into the future a little bit, by 2060, the number of people age 65 and older is projected to be almost about 14 million people with Alzheimer's disease. In comparison to about 2020, there was 6.1 million people. And honestly, that's a pretty raw fact, but in the most recent decades, people have noticed, like heart failure and different heart diseases declining, and then Alzheimer's is creeping up. But that could just be from the aging population, the baby boomers. There's a huge amount of baby boomers coming these days that are expected to turn 65. And additionally, doctors are becoming more and more aware of what is going on with symptoms and just identifying the disease in general. And we're going to hit 7 stages of dementia, So, you can think of your loved one during these 7 stages of dementia and kind of see where they are at this given time. So stage 1, there's typically no impairment. You can head to the clinic, get a physical done, and your doctor may or may not be able to identify any memory lapses, dementia impairment, things like that. Stage 2, a person may start feeling a little bit different. They might think that they're having just slight memory impairments or some lapses in memory. And they could be using some words for substitution, per se. They could be, saying one word instead of the next, just to cover up that memory impairment. And then misplacing familiar items. I know that Christina mentioned that a little bit, but wallet, phone, keys, where are these things? I lose them. Where are they? And then stage 3 would be some notable memory loss. So difficulty with word findings, struggling to keep track of recent events, issues with planning and organizing appointments, managing money, and then having that hard time with medications. They're going to need some assistance getting those medications to them and at the appropriate time, appropriate dose. And I would say, mid-stage 3 would be a great time to get involved with the DCAN. They have fabulous resources, to help with symptom management and then slow that progression. I know a lot other areas don't have such a great resource, so we should really be able to utilize that a lot here. Stage 4 would be difficulty concentrating, confusion, disorientation, difficulty completing those complex tasks. Just like Christina had mentioned, we all get dressed, but it could be in a different way. That could be a complex thing that they would be not able to do. Paying bills, increased difficulties with problem solving, and they may become withdrawing. They might withdraw themselves from social activities. Stage 4 would be difficulty concentrating, confusion, disorientation. Oops, excuse me. I already did that one, didn't I? Yes, thank you. Stage 5, excuse me. Reduced independence and emotional disturbances. So those are those personality changes, mood swings, gaps in memory. And then they're needing assistance with activities of daily activity. So, and they're having that hard time recalling a telephone number that they may have known for years or an address. And then stage 6 is severe cognitive decline. Symptoms include those personality changes, difficulty communicating, behavior changes, and then sometimes we see that risky behavior. So wandering, heading outside, maybe they're heading to the grocery store at 2 in the morning without a jacket, middle of winter. And then this stage 2, we see some incontinence issues, so incontinent bowel and bladder. And then, as I'd like to say, hospice would be a great time for us to come in and support. We can be a great companion during these critical phases, support and enhance the patient and enhance the life of the caregiver, kind of give them that relief from that 24-hour care. We offer ourselves as a lifeline to patients, and we really focus on pain management, symptom relief, and the emotional well-being of the patient and the caregiver. Stage 7 is severe cognitive decline. Individuals lose the ability to communicate, difficulty swallowing, mobility issues, unable to control movements, maybe some jolting behaviors. And then they'll need they'll need that full assistance of activities of daily living. So you might be assisting with a full bed bath, a shower, medication administration, transferring them. And then loved ones in this individual stage with dementia can find hospice care in their corner. It offers realistic support and also companionship during these challenging times. We work closely with families and facilities, and then we offer respite care advice, education, and emotional guidance. And then families can expect a huge interdisciplinary group once someone's on hospice. We have nurses, doctors, social workers, chaplains, even CNAs, so aides that will come and assist. And then we have also various therapies too, music therapy, massage therapy, and then new in the St. Cloud area, we're trying to get some pet therapy. So if you have a therapy dog, we would love to talk to you. And I know my volunteer coordinator is probably like, yes, thanks for the push. But yes, so we can assist with that progression of dementia. It can be really emotionally demanding for families. And so we provide that psychosocial support and help during that, and then cope with unexpected changes and challenges that might pop up one day, and then they'll be fine the next. So we're here for those changes as well. I'm going to buzz into advanced care planning. This is another big topic that we're just going to touch on briefly, but I recommend advanced care planning for anyone that's 18 years and older. It really assists the planning, and it provides the relief for both the patient and the caregiver. It can be really overwhelming to make healthcare choices on your loved one's behalf if you don't know what wishes they would like. It allows you to tell someone what you would like, and if you're unable to do that later on in the future. We do have resources in the back if you'd like to do any advanced care planning. And then just planning for the future. Only 33% of Americans complete any sort of advanced care directive. Making healthcare decisions for someone, it can be overwhelming. So to help plan for the future, we recommend to start the discussion sooner rather than later. There's always accidents that may occur, but as everyone ages, we just want to make sure every family member knows what our wishes are as we continue to get older. Getting permission in advance to talk to important persons like a lawyer. You might have to have someone in your ball field and ask questions about the care, any bills, financials, and then you might not be able to get through if you don't have consent. So this is a huge one. And then consider legal and financial matters, options for home care, long-term care, and then funeral and burial arrangements would be something else to consider. And now we're going to get into the little bit of the meat and potatoes of the presentation. Anticipatory grief and how that starts before the diagnosis. And we're really going to focus today on Alan Wolfelt. We really focused on his anticipatory grief beliefs. So anticipatory grief refers to feeling of grief before an expected loss. This type of grief starts when early signs of dementia are noticed and lasts through the end of life. And there's two types of this anticipatory grief or components, and that's process and projection. Process is living with the change. So with dementia, you begin to see that person changing right before you. As they slowly change, your relationship changes with them too. You're not just the significant other anymore, you are the caregiver. And these changes can cause grief because the characteristics of the person you once knew are strange, new, and can be difficult. Projecting is our capability or capacity to think about the future and what's to come. And that can give you a lot of anxiety, grief. Anticipatory grief is a normal mourning process. These emotions can be minor or intense, and as your loved one changes, each change can cause more grief. There are some other situations that can cause anticipatory grief, and it's not just for individuals with dementia, but even the aging process. We can feel overwhelmed, we can feel saddened by that. Terminal or a life-threatening illness. Even divorce could cause some anticipatory grief. Pending big major medical procedure, and then like a major life transitions. So like, graduating from college, getting married, maybe moving to a new geographical region can also have anticipatory grief with that. Even the patient that receives the diagnosis can experience anticipatory grief themselves. And there's many things that they grieve about, which they might not even disclose to you. So they might be feeling missing future life events, the loss over experiences that they will miss, loss of control and independence, and then the loss of sense of self. They're not feeling like themselves. They can't communicate. Even though the patient and the caregiver are grieving, it doesn't always align. So I could be grieving about my loss of independence, and they're grieving because they lost their independence. They can't go to coffee anymore with their friends. Anticipatory grief describes a set of complex feelings and experiences while they're anticipating that death ahead. The caregiver is grieving the loss of their loved one's illness, but they're also going to be losing, that ability to communicate with that person. Intimacy and special bonds. There's been times in the past where, you're going in for a hug and they don't recognize you, and that can be very hurtful. Future plans, support, emotional, financial, and personally. Shared hobbies and interests, and then just that freedom to do other activities. While caregiving for a loved one, you might experience the feelings of sacrifice and burden. I just want you to think a little bit when you had just stopped and retired. Were you going out to coffee 3 times a week with friends, and then a jolting change occurred overnight? It's common to feel angry, scared, or on edge. And you think about losing that life you once led. You can feel some heartfelt sadness and longing. You might grieve the loss of your old life and then feel powerless. There's also some worry and isolation. You may lose connections with individuals you love and care about because you have to focus on caregiving. Some tips upon early diagnosis of dementia can be helpful to the caregiver and the patient by reflecting on memories and significant life events. So pulling out that photo album or your phone nowadays and kind of reminiscing about those times that you had spent together. Attending unfinished business. Reconnecting with estranged friends and family. Doing that advanced care planning like I had mentioned. Let loved ones know what your healthcare choices are, and then maybe discussing that legal burdens or financial concerns that you may have.
All right, so anticipatory grief, it is believed to have various aspects and occur in different stages, so that's kind of what we'll cover next. So there's a couple different grief theories. There's the 5 stages of grief and then the 4 tasks of mourning. The 5 stages of grief are probably the most familiar ones for a lot of people, so I won't go into too much detail about them, but they are denial, anger, bargaining, depression, and acceptance. What I often tell families and patients is that grieving is not linear. You don't go through all of the stages one by one and then start over again. I use the idea of throwing a ping pong ball into an empty room. You're going to go through them at different points. You could be in denial one day, depression the next, bargaining one day, or acceptance. And this can change hour by hour and minute by minute as well. And then there's the 4 tasks of mourning. So the first one is accepting the reality of the loss. Many times we find that we don't want to think about what is happening. We don't want to know, what the end result is going to be. So sitting and thinking about what is to come can sometimes help us through that mourning process because we're acknowledging, what is going to happen. Processing the pain of grief. Grief is never fun. Grief isn't a pleasant experience, but acknowledging and processing the pain and the frustration that we're feeling can help you move through the process a bit easier. Adjusting to a world without the deceased. So what is your life going to look like when you're no longer caregiving or you don't have that person in your life anymore? Oftentimes it's hard to imagine a world without your loved one. So trying to find who you are and the things that you enjoy and start kind of planning what life is going to look like once they are gone. And then finding an enduring connection with the deceased in the midst of embarking on a new life. So just because the person has passed doesn't mean that you have to forget about them and move on. You can incorporate them into the new life that you are making for yourself. So, keeping their memory alive, keeping that connection with them, but then also experiencing the life that you have to live now, that you don't have to be that caregiver anymore. So there's also the 6 needs of mourning. Some of them are parallel to the 4 tasks of mourning, but the first one is acknowledge the reality of your grief and the pending loss. It's important to gently ease yourself into that process of grief. Once you decide that you're ready to embark on that process of anticipatory grieving and mourning, it doesn't mean that you have to grieve everything all at one time. It might be grieving the loss of knowing that maybe Christmas won't be the same without your loved one there this year. And just sitting with that feeling and thinking of the ways that you can incorporate their memory into the future Christmases and that sort of thing. Embracing both the pain and the joy of your anticipatory grief. While there are many emotions in the grieving process, you can see that there are painful emotions, but there's also joy. You get to learn about yourself. You get to learn how resilient you are. You get to find how you handle these moments of stress. And so embracing that while there may be good days, there may be bad days as well. Explore memories associated with the loved one or the attachment that you're losing. Share memories with your sick loved one. If they're able to converse with you, ask them about their life, ask them about the stories that you want to know. Many times I hear from people that they wish they'd sat down with their loved one for longer and listened to the stories about their life. One thing that we've incorporated into my personal family is there's booklets now that people can fill out, and it asks you all sorts of questions about your life growing up, what your childhood was like, what your parents were like, how was your marriage, did you get along with your siblings? But it's a tangible piece of their life that you can keep and you can pass down through generations. But it gives them the opportunity to tell those stories that maybe you wouldn't even think to ask. It's also important to acknowledge what you're losing, but remember that what is truly important. So you are losing your independence, you are losing your loved one, maybe a relationship that you've had for a very long time. But what's important is that you've been able to have that relationship with them. You've been able to be there and support them through this time. It can be important to ask your loved one how they are feeling about the loss, the attachment that they're losing with you as well, and see if there's any memories that they feel are important for them to share. Number 4, develop a new self-identity. Oftentimes we tend to associate ourselves with the people that are closest to us. I'm so-and-so's spouse, I'm so-and-so's sister, I'm so-and-so's friend. But when you take away those people, who are you at the end of the day? So it's important to figure out who you are, what things you enjoy, find that self-identity outside of those people that you are with on a day-to-day basis. And then to figure out who you're going to be when they're gone. You can still consider yourself so-and-so's spouse or so-and-so's child, but outside of that, when you're no longer caring for them, who are you? What are the things you enjoy? What are the hobbies that you have? What things do you have to contribute to society? Number 5, search for meaning. That's meaning in the now and then meaning in the future as well. During this need, we see a lot of people lean toward their spiritual or religious beliefs, and it's always encouraged at this stage to kind of throw yourself into that experience. In religious and spiritual communities, you find a lot of support, extra community, opportunities to take time for yourself, opportunities to self-reflect. So even if that's just asking somebody to come over for 1 hour a week so that you can go to church or you can go to a service, those are important. So finding that community, finding that spiritualness, leaning into that is really, really important. And then number 6 is finding and accepting help from others. This can be very, very difficult. I feel like in central Minnesota, we kind of want to do things ourselves. It's hard to reach out and ask for extra help, but there are so many resources out there. There's DCAN, there's hospice, there's home care. There's so many people that are willing to come in and help. And even when you're doing that anticipatory grieving, maybe start reaching out to those people in your life that you feel like will be there for you when times get maybe even more tough than they already are. It's so important to have that extra community for yourself too. You're pouring everything you've got into this person to help take care of them, to keep them safe, but who's helping pour that love and that trust back into you? You can't pour from an empty cup. So even if it's somebody coming over so you can take a 10-minute walk or take a nap because it was a rough night, those things are really important too. So we just have some different coping skills. There's healthy ways of coping and there's not so healthy ways of coping. So we just picked out a couple to go over. The first one, letting yourself cry, but also letting yourself laugh. There are so many different emotions that come with caregiving and grieving and loss. So remembering that it's okay to cry, but it's okay to laugh. It's okay to share those memories and those funny stories. Many times when we have a patient who's actively passing, I like to sit at bedside with them and their family and listen to all the funny stories, and in the midst of all the tears, everybody ends up laughing at something silly that this person had done in their life. So remembering to also let yourself laugh is important. Sticking to a routine. Routines are very, very important. Oftentimes when we get out of a routine, that's when you can see some of those depression symptoms kind of sneak in because you don't have a purpose with your day. So if you got up and drank coffee every morning at 6, try to stick to that routine. If you went on an outing every Wednesday, stick to that routine. It gives you purpose. It helps you feel like you're doing something with your day. Journaling is great, especially if you have some hesitancy with sharing your emotions and feelings with other people. Journaling is a great way to write down those thoughts and those feelings that you have that maybe you're not ready to share, but putting them down on a piece of paper can make you feel like you were able to get them out instead of bottling them up and holding them in. Taking care of your body. Your mind and your body are so linked. So if we neglect our body, we neglect our mind. So getting outside, eating well-balanced meals, sleeping if you can, maybe even just stretching or going for a walk on a treadmill, whatever you have. Also finding time for yourself. Maybe it's just reading your book for 10 minutes or sitting and listening to some music. That's very important. Counseling and support groups. There's quite a few of them in the area I know that offer different support. I know through Moments, our bereavement department also holds different groups for those who have lost loved ones. And they do it virtually so that people can attend from all over the country if needed. Seeking medical attention for yourself when needed. I find this a lot when I'm talking to caregivers that they're so focused on the one that they are caring for that they forget about taking care of themselves, getting to their yearly doctor appointments. Oh, I've had this lump on my arm for a long time, but I just don't have time to get into the doctor. I don't have somebody to come and stay and watch my loved one while I go. But doing that is very important. You can't continue to care for somebody if you're not well yourself. So making sure that you're getting into those appointments. And then, leaning into your spirituality or your religion, kind of as we touched on before, it can be a really big asset. So knowledge is power. The more you can learn about grief, the more you can learn about coping with loss, any resources that you can get, those are always important. The more you know, the better you can care for yourself and for your loved one. So always reaching out to any resources that you have and that sort of thing. Working with a dementia care navigator or a team of professionals results in less stress and a better outcome for the patient and the caregiver. Caregivers do see an improvement in the quality of life and health for the person they care for as being the greatest positives of working with a dementia care navigator. So that's really important. And then other benefits for the person living with Alzheimer's or other dementia includes less depression, a longer period of time at home, and then fewer of those behavioral symptoms as well. Respite is another very important thing. Oftentimes we work to find that for our patients and their families. We can find it through nursing homes, where through their care benefit, you can be there for up to 5 days to give family a reprieve. Maybe they need to go to a funeral, maybe they just need time to themselves, so that's important. The top 5 stressors for caregiving are cost. Medical needs are very expensive, especially if you're bringing care into the home. That can be expensive as well. Coordinating with multiple doctors. Oftentimes, if you have complex diagnoses, you're seeing multiple people at a time. Securing appointments. It's already difficult to find an appointment in the healthcare world these days, and then to find one that fits in your schedule can be difficult as well. Getting help taking a break. Sometimes it's hard to find somebody who's willing to come over and do caregiving, especially if you're in those later stages of dementia and they're needing extra help. Some people might feel hesitant to come and help you out at that point. And then finding appropriate doctors. Are you going to a doctor who understands your loved one's disease, or are you just going to a general practitioner who you've been seeing for years? So that can be a stressor as well. So the 7 acronyms for respite. R stands for rest and relaxation. Obviously, I tell everybody caregiving is a 24/7 job. You don't get to shut it off and go home at the end of the night. So finding time to rest, relax, recharge your body is so important. E stands for energize. Just getting a few hours to yourself can help re-energize your body, help you feel ready to take on the day again. So that's another way that respite can help. S is for sleep. Many times as a caregiver, you're not getting a full night's sleep at night because maybe your loved one is up and down throughout the night. So respite can be used to help get a couple good nights of sleep. P is for programs that can help you. There's many different forms of respite. I know you have different options through the VA. There's options through the Medicare benefit, so finding the programs that work for you. I is for imagination, letting your mind be free, enjoying those things that maybe you didn't get to do before. T is for take 5. Sometimes you just need to sit and take a few moments for yourself, and just kind of take in what's been going on, process all of that. It's hard to do that when you're also caregiving at the same time. And then E is for E is for exhale. Breathing is so important too. Taking a simple deep breath is great. I teach a lot of people square breathing when I'm dealing with caregivers who are maybe dealing with some burnout. So it's breathing in for a count, holding for that same count, breathing out for that same count, and holding. Helps regulate your bodies, helps you get breath, oxygen, and it's just a great tool to have. Just a story, a distraught man in a caregiving group once told me he was at his wit's end taking care of his wife for over a year. She had Alzheimer's disease. He was retired but had given up his Thursday afternoon golfing with his friends to do caregiving. I asked why he didn't continue his Thursday afternoon off. Was it cost? No, he said, it was his guilt. He thought it was selfish to want some time off with his friends. What would people say? My recommendation, take Thursdays off, golf with your friends. You can both be a good caregiving husband, and take care of yourself. Paradoxically, taking time off is a gift to your ill wife. She will have a happier and healthier caregiver and husband. So again, if you're not pouring into yourself and enjoying those things that you always have, it's harder on your loved one as well because you're not at your best either. So what to do when the loss happens? We've been anticipatory grieving, we've been doing all of the extra work, but then what happens when the person does pass or when you have extra loss? So anticipatory does not usually take the place of post-loss grief. So the things that you're going to feel after the death of a loved one is going to be very different than your anticipatory grieving. You can prepare as much as you want, but it's even more difficult once that loss does happen. You may feel all those same emotions again. So just having Being kind to yourself, knowing that it's okay, knowing that you might start all the way back at square one and have to go through the grieving process again, and use all of those tools that you had before is really, really important. And then reconciled grief. This is when you kind of sit with and understand that you are grieving. You've worked through all of those tools that you have, you've done the grieving process, and now you've reconciled to the fact that you can grieve. You can work through that, and you know what to do in the future if there is an extra loss. You know, anticipatory grieving starts so early. It can be just the loss of the person that you knew. You know, whoever you're caring for, you had a relationship with them, but then their disease progressed, and now they're somebody different. And so, but you know how to start that grieving process over again to help yourself as well. So grief is like the ocean. It comes in waves, ebbing and flowing. Sometimes the water's calm and sometimes the water's overwhelming, so you have to learn how to swim. And that's what these resources are great for, is teaching you how to swim in the midst of all of the waves that are coming and crashing in. You know, some days are gonna be great. Some days you're gonna have no issues. You're gonna get a full night of sleep. You ate all your meals. It was a good day, and then the next day could be totally different. So learning what tools work best for you. And that's what we have.